and like, you're too noisy. And like, I said, you don't have to be around me.
Friendship may actually go beyond just relating on
A superficial basis.
There's the adage that says, show me your friends and I'll tell you who you are.
There are some of us who are not very good at regular visit, but because they are friends,
you have to.
In order to maintain that friendship.
The emotional state of the parents is usually directly proportional to the emotional state of the children.
Hello viewers, you're welcome again to our favorite family show, The Living Room, right here on Equa Television. We will be talking about something very interesting today, which seems to have bothered quite a number of us, the issue of cancer. And today we'll be talking about cervical cancer. My name is Amaka Ocheke, and right here in the studio with me to delve into these very serious issues are two experts on the issue of cervical cancer, and they're experts because they are gynecologists, and that's disease that concerns women's or females' reproductive organs. So we have some powerful ladies here, Dr. Awazi Onoja and Dr. Sarah Alada. Thank you for joining us today.
Thank you.
Yes, and they'll be discussing cervical cancer. And in the course of the program, we also have room for you to call in and ask questions that have been burning, things you want to know about this cervical cancer, and also to contribute to the conversation. So let's get the ball rolling. So this past week, we've started celebrating World Cancer Day. So Awazi, what can you tell us about what is going on, World Cancer Day?
Well, the World Cancer Day is celebrated usually on 4th of February of every year, and it is aimed at trying to reduce millions of deaths by creating awareness on cancers. And we also use that medium to press the government and individuals to take actions that will help to reduce the prevalence of this disease, which has caused a lot of havoc for homes because of the great number of problems causing deaths, premature deaths, morbidity, and disability in homes. So the World Cancer Day has been brought up to help to reduce the problems
and create awareness.
Yes, yes.
So, Alada, let's turn to you, Sarah. What's the theme of this year's Cancer Day?
Okay, thank you. Good evening, viewers. The theme for the World Cancer Day this year is closing the care gap. And it's closing the care gap because it's been observed. You know, when you look at our setting, the developing world and then the developed world, the level of care for people that have cancer, the disparity is actually much. So this year, which has been the theme since 2022, 23, it was all the same with is rounding up 2024, closing the care gap, is a way of creating awareness, also keeping our government, our leaders, on their toes, challenging them to be able to close this care gap so that cancer can happen to anybody, anywhere. You can be old or young, it can happen to you. But the fact that you have cancer, the difference in treatment shouldn't be that much. You should be given a chance to be able to survive cancer. Thank you. So that's what the theme for this year is all about, closing the care gap in cancer.
So one of the things that's come out from what you ladies have said already is the fact that when people have cancer, what I'm hearing is that they don't necessarily have to die, right? So cancer is not a death sentence.
No, it's not.
Okay. So viewers, I hope we're listening, that if you have cancer, it doesn't mean you will die. Okay. So what are the things that would help people who have cancers to have a good outcome, to survive cancer?
One of the things that will help people to have good outcomes if the cancer is detected early.
Okay.
And then there are some cancers that can be prevented. So if they can have interventions that will prevent them from developing such cancers, and then if it's detected early, when cure is almost achievable at that point, they will have good outcomes.
So early detection, prevention
Yes.
are very important things to help people survive
Yes.
cancers. Okay, we've been saying this cancer. So Sarah, what is cancer?
Thank you. So, cancer is a disease condition in which some of the body cells become abnormal. So, how you know they are abnormal is that they start dividing uncontrollably, and because they divide uncontrollably, they actually invade that's spread to surrounding tissues and then or even to other parts of the body. As a result, you can have like a growth. So that is exactly what cancer is. Cancer, as you said, it's a huge burden for us in this world because it's one of the leading cause of death among people, both men and women. So prevention, as you said, for those that are preventable is
Is
actually
key.
key. Yes.
Awazi, do you want to contribute something to that, to our definition of cancers?
Yes.
What cancer is, breaking it down so that
Yes.
everybody
So
knows.
yes, as she said, it's an abnormal growth of abnormal tissues, and they grow uncontrollably, affecting, invading the surrounding structures, and they can also go to distant sites. What they do is also to prevent normal tissues from carrying out their normal function. So there's abnormal functions of one normal tissue because of their growth.
So in the body, the growth has some control.
Yes.
Growth of cells has control. So we have policemen. We have things like policemen in the body that say,
Yes.
you, stop there.
Start there.
So in cancer, it means the policemen are not working well, or the drivers are not listening to the policemen,
Yes.
and they are going doing what they want to do. I think
Yes.
that's in simple terms.
Yes.
Yeah. Okay. Now let's get down to the cervical cancer that we want to talk about today. What is cervical cancer?
So I would like to first of all see what the cervix is.
Yes.
The cervix is the lowermost part of the uterus. And
What is
in
the
layman's,
uterus? Yeah.
yes, so that's the womb. And in layman's terms, we say it's the mouth of the womb. That is
Okay.
what opens up completely, and then the baby is able to be
Okay,
delivered out.
during labor.
During labor, yes. So it's a very small part of it's just a cylindrical portion at that lowermost part of the uterus. And this cancer that affects this small part of the uterus is the most common cancer that affects the female reproductive organs. Yes, so it's in the ranking of all the cancers in the world, is the fourth most common cancer. That's cervical, breast cancer is the first, then colorectal cancer, lung cancer, and then cervical cancer. So it's a cause of morbidity and mortality, death and severe disability amongst people, amongst women. So it's the commonest gynecological cancer. Yes. Second, and then the second most common female cancer, again second to breast cancer. In our country, is the commonest cancer in the north, but in the south is the second most common cancer after breast cancer.
So it's a problem.
It's
for
big
us.
public health problem.
Okay. Sarah, do you want to contribute to the magnitude of the public health problem? Because Awazi has told us that something dangerous is happening. And see, as she has said, it's the most common cancer in the north.
Yes.
Okay.
Thank you. So WHO estimates that over 604,000 women are diagnosed with cervical cancer yearly, and out of that, over 342,000 are actually affected. They die from this cancer. And the sad thing about it is about 75 to 80% of these statistics I just mentioned occur in low and middle income country, and we know Nigeria is part of that category. So the magnitude is quite much. And when you coin it down to Nigeria, about 14,000 new cases, that's
Wow.
every year, women are diagnosed, and then over 8,000 women die from this disease. I know what is saddening about it is that cervical cancer is actually preventable because the risk factors are known.
Yeah, we'll get into that. Now, between developed countries and developing countries or low and middle income countries. Why that difference? Why that wide gap in cervical cancer incidence or prevalence? Which one is it? Is it incidence? Incidence is new cases,
New
but
cases, yes.
cervical cancer incidence and the progression, women dying so much. Why that wide gap?
Thank you very much. There's a wide gap because she said saying something that cervical cancer is a preventable cancer because the cancer of the cervix has a precancer lesion or condition that can be detected 10 to 15 years before the main cancer develops. So the high income countries or the developed world, they have organized screening systems that can detect this pre-cancer disease long before the cancer develops, and they are treatable. So the women never get to develop the cancers, and they have also more developed facilities for early diagnosis of these women where the cancer can be treated. But in the developing countries, we don't have an organized screening system. So most people don't even know about it. Those that know don't go, or they go haphazard, and they go. There's a sequence. There's a frequency for screening, but those that even screen don't follow that frequency. They just go as they like. So they are likely to miss women that have the cancer.
So are we saying that if we want to survive breast cancer, we should all leave this country? We should all go abroad to developed countries so that you don't have cervical cancer?
No, that's where our government comes in. Yes, to help to the political will to create these facilities for this screening, awareness like what we are doing, let people be aware of these screening programs, make them available in various centers so that people can access them, let it be cheap, and then get it close to them, because sometimes we have transportation problems. These screening centers are not everywhere. We need specialists to read the results. Yes, so, and the specialists are not so many. So there's a lot the government can do. Once we get them, I think that's why the theme for this year is very important. Together we can challenge our leaders, because they have a big role to play in helping us cover this care gap.
Leaders were coming. We're challenging you to do what needs to be done. So, okay, let's get down to it now. What are the causes of cervical cancer? What causes cervical cancer?
Okay, thank you. So, with a lot of research that has been imputed into cervical cancer, human papilloma virus, a virus has been isolated as one of the main causative agents of cervical cancer. And this human papilloma virus, what we call HPV, is actually a sexually transmitted infection. So factors that enable it for you to acquire HPV infection actually increases your risk of having cervical cancer. And some of these factors, as I say, what is the cause, the risk factors, we call them risk factors, are early age at puberty. That's the first age in which a girl is exposed to sexual intercourse. So that's a big risk factor. We talk about early marriage, and then multiple sexual partners. Remember I said the human papilloma virus, which is implicated in 99.7% of all cases of cervical cancer, is sexually transmitted. So a woman has multiple sexual partners, she's at risk of having cervical cancer. In addition to that, there's a term we call the high-risk male. So if you have a partner or your spouse as well, he has other multiple sexual partners, you are actually at risk. He has a penile cancer, you are at risk. Or he has another another partner that actually has developed cervical cancer, then that places you at a risk of it, yes. And then other factors too that has been implicated is cigarette smoking and the immunosuppressive states like having HIV/AIDS, and also those that use steroid, long-time use of steroid, among others. So these are some of the factors that have been implicated as they predispose risk factors to having cervical cancer.
Okay. So, viewers, I hope you heard. They said human papilloma virus, HPV, is a sexually transmitted virus. So when we're talking of sexually transmitted diseases, it's not only gonorrhea and syphilis that the people with microphones go around the market telling you, and they know, and stuff. They'll be telling you stuff. It's not only those things. Human papilloma virus is a sexually transmitted disease, and they show for face. They show for face. So, for me, what other thing I'm hearing from here is that God's instruction to all of us as Christians to zip up. One man, one wife will be helpful to us in reducing the incidence of cervical cancer. Okay. We hope we're listening. Okay, so how does cervical cancer present? How do you know that you have cervical cancer? Maybe Awazi, you start that.
Thank you very much. The clinical presentation or the clinical features of cervical cancer is varied. For the early disease, there may be no symptoms. Those that come very early, there may be nothing. So that's why the screening is important, because the screening can also detect those early disease.
Stages.
Yes. But then the other things that the woman can complain about is abnormal uterine bleeding. By that I mean a woman that begins to bleed following sex, we call that postcoital bleeding, or a menopausal woman, a woman that stopped seeing her regular menstruation for up to a year and starts bleeding. They can have, we call it postmenopausal bleeding. Then intermenstrual bleeding too is also there. Then they can also have foul-smelling vaginal discharge. It's usually watery, a bit bloody, but it has a very bad smell. Then other conditions, as the disease progresses and affects the uterus can be enlarged and can press on the bladder, so they can start having some urinary symptoms, difficulty in passing urine. They can have even going to urinate very frequently. Sometimes it blocks the passage of the passage where urine comes from the kidney to the ureters into the bladder. And once it does that, it can even affect the kidney functions, and they can even come with kidney failure. Yes, it can also present with back pain, especially in advanced stages.
Cases.
Yes, back pain. They can have weight loss is there. They are bleeding from it, so they can have what we call anemia, reduced blood level. So these are some of they can even have this constipation, because the uterus is sitting between the bladder in front and the rectum behind. That's the large intestine. So if the uterus and the cervix are enlarged, you'll press on the large intestine, and the patient can even present with constipation, difficulty passing stool. So these are some of the symptoms.
Okay. Sarah, is there anything she left out?
Said most of
Yeah,
it. In
yeah, said
addition,
most.
maybe leg swelling because of the pressure symptoms and the urinary
Problems.
complications. Yes.
So this postcoital bleeding, postmenopausal bleeding, why would you have bleeding in cervical cancer?
So bleeding occurs in cervical cancer. As you remembered, we said the cervix is actually, well, the layman term is the mouth of the womb, and the cervix actually is that part of the womb that when you check the vagina, it's there. So one of the reasons for the bleeding, especially postcoital, that's during sex, is because the cancer affects the other part of the womb that is easily accessed through the vagina. So if there's a mass there during sexual intercourse, a woman will bleed.
Okay, from the contact.
From the contact, mostly
Okay.
from the contact, because it usually grows out as a mass, either outwardly or inwardly. So that's most of the reason why they actually bleed. And of course, the mass can also extend to the body of the womb. So from there, with the lining, it also causes bleeding. And then, as we said, cancer cells generally, what they do is that they disrupt the functions of the normal body. So even what the normal body cells are supposed to do in terms of producing red blood cells and all those, it consumes. It's like and the energy that the body produces, the cancer cells, because they are multiplying excessively, they actually consumes that. So part of the reason why we have all these issues.
Interesting. Okay, so now a woman has all these things we have complained about. She has postcoital bleeding, that's having bleeding after sexual intercourse, or she has stopped menstruating for some years and suddenly sees that she's bleeding again. what is she supposed to do? Because I know I've had a patient before. She said she was ashamed that she was bleeding, and she didn't know how to tell her children that she had stopped menstruating many years ago. Then suddenly she started seeing blood, so she was ashamed, and she didn't tell anybody until the cancer had advanced. So when women pick up these symptoms, what are they supposed to do? Or they notice these symptoms, what are they supposed to do?
Well, we encourage women to present immediately to the hospital. I know that the symptoms that are treated with the cancer of the cervix are symptoms that many will want to keep and
Private.
yes, private because of the presentation, but they are signals to something very sinister. So go immediately to the hospital. Don't keep it for too long, or in fact, as soon as you see it, present to the hospital, let it be checked. Because the truth is, other conditions too can cause bleeding after sex. So it may not be cancer of the cervix, because now we're in a society where people are afraid and they don't want to even come out, but it may not even be the cancer of the cervix. So present and be told there is something else and not here. And if it's cancer of the cervix, let it be gotten early and treated. So not just to any hospital, get to a gynecologist so that you can be assessed quickly and thoroughly. Thank
Sarah.
you.
She's right, because the symptoms you mentioned are actually red flag. Imagine a woman, you have stopped menstruating, as you said, and suddenly you see blood. You know, it's something the public, while we're also creating this awareness, it's nothing to be ashamed of. It's nothing to be ashamed of. People should know that once you notice anything abnormal, present to the hospital. It's better. Early detection is what actually helps. Unfortunately, our women, because of all those cultural things, being shy, most of the time is when it's already advanced. That's when they present. So please present. If you notice something, it's better they tell you it's not it. You go and come back.
It is it.
Yes.
And you are hiding.
Exactly.
And viewers, you heard what they said. Go to a hospital, and not just any hospital, where a specialist can see you. If your hospital does not have a specialist, they have to refer you to where a specialist, a gynecologist, can see you. And Dr. Noja said, a hospital. So we all know what a hospital is. It's not where the native doctor is. That is not a hospital. It's not where church is, also not a hospital. You know, we want people to go to church, but pastors have their work, doctors have their work. Abi? They say everybody should stay on their lane. So, pastors, stay on your lane, let doctors stay on their lane. So the things that are medical, please go to the hospital and let them assess you properly and tell you what it is, instead of keeping quiet or doing other things until the thing has advanced. Because we've already said earlier that the earlier we pick it up, the better for all of us. Right? Okay. So we'll talk now about prevention. Prevention is key. So okay. Sarah, you want to go? Let's talk about prevention.
Yes, prevention is key. Prevention is key. So for cervical cancer, it's actually a preventable cancer, in that we already know the causative agent, you know, the human papilloma virus, which is sexually transmitted. So prevention of this cervical cancer involves creating awareness, as we are saying right now, what we are doing. Creating awareness, health education, let people know that there's a disease like that, the symptoms of the diseases. Then in terms of, you know, we cannot be able to, predict who will have cancer or not. However, I earlier mentioned about risk factors. So part of prevention too is being able to modify those risk factors that can be modified. You know, we talked about early age at Kwetaki. So it's good to be able to tell girls to keep to themselves. We talked about zipping our trousers.
Zip up. I don't know, they've stopped doing that advertisement, but I used to like it. Yeah.
So zip up the trousers is for both boys and girls.
Yeah.
You know, avoid early age at sexual intercourse. And we know God intends sex to be in the context of marriage. So it's important. I say our God is smart when he gives instructions. He knows why he's giving it. It's for our own good. So avoiding things like the risk factors I said, early age at Kwetaki, avoid multiple sexual partners. So we should be faithful. As Christians, we should be faithful to our spouses. It's a key thing. And then also, those that smoke cigarettes should avoid it. But one of the main strategies for prevention of cervical cancer that recently our government is actually waking up to is the issue of the HPV vaccine, which is very key. You know, this HPV vaccine is a safe vaccine. Just like we have childhood vaccines, this has been developed. After a lot of research, we are happy that we are seeing it now. So it's in the stage of implementation in other states. Some have started. And this human papilloma vaccine is recommended for both girls and boys, but right now we are actually focusing on our girls from the age of 9 to 14 before they become sexually active. That has been shown to be highly effective in actually prevention of human papilloma virus. And then apart from the vaccine, which we'll talk more about it, we talk about screening. Screening is very important because early detection actually helps. As she said rightly, is that the pre-cancer stage of this cervical cancer can be detected before it advances to cancer, almost 10 to 20 years. So imagine if you are able to screen early, we are able to pick it up at a stage in which we can treat. It's a very big strategy in terms of prevention. So please, our mothers, our daughters, everybody should be screened from the age of 21. What we call the pap smear is a good strategy for prevention. Thank you.
So where do we do this? Where do we find this screening?
The screening, as you talked about,
In hospitals?
Yes, pap smear is done in Youth. It's also done at the Bingham University Teaching Hospital. It's also done at Ola Hospital, and several other private hospitals also do it.
That's in Jos.
In
But
Jos.
because we have viewers from outside here, so where do they access?
Hospitals. Generally.
Okay, so you go to a hospital and find out.
Yes.
Even if they don't offer pap smear, they will direct you where you can
yes.
access pap smear. Okay, we'll still talk more about these screening things and the vaccine because I know we have a lot of questions on the vaccine. We will go on break, viewers, and then when we come back, we'll continue the discussion on cervical cancer with Dr. Sarah Alada and Dr. Awazi Onoja right here at the living room of Equa Television. Please don't touch that dial. Keep watching. We'll be right back after the break. Hello viewers, my name is Amaka Ocheke. We anchor the program, The Living Room, right here on Equa TV International.
You are welcome to watch us every Monday.
The Living Room is a very interesting family program where we discuss everything you want to know about family.
Talk about our children's mental health.
Keep watching. Our program is always here, 5:30 every Monday. We want you to ask questions. We want you to phone in and drop topics that you want us to talk about, even on our media handle on Facebook. We're there. So keep watching, keep listening. The Living Room. Welcome viewers back from our break. Thank you for not touching that dial. We're right here again at the living room of Equa Television talking about cervical cancer. My name is Amaka Ocheke and I've been here with Dr. Awazi Onoja and Dr. Sarah Alada. They've talked a lot about cervical cancer. They've talked about the causes, the HPV virus, the predisposing factors, and now we've been talking about how to prevent cervical cancer. Dr. Alada raised the issue about lifestyle modification. She raised some issues, and one of the things that for me stand out is the fact that we should zip up. don't have sex until you are married. And when you are married, stay faithful to your partner. And not just the women, also the men. Because even if you are faithful and you have a husband who has multiple sexual partners, he also puts you at risk of cervical cancer. So men, I know that the society accommodates sometimes our philanderings, but God expects everybody to zip up until it is time. And then when you get married, stick to one sexual partner. That is what God has called us to do. Okay, back to the vaccination. Yes. So, what's the vaccination schedule? Who should have the vaccine? And what are the side effects? Because I know rumors have been going around that the vaccine kills people, the vaccine causes people not to get pregnant, and all sorts of things that people have been saying. So please speak to that.
Okay, so there are several of the vaccines that are available. We have three most commonly: the Cervarix, which is a bivalent vaccine. Which I talked about human papillomavirus. It has different variants. So 16 and 18, they are the most
Common.
yes common in causing the cervical cancer. So that vaccine covers those two. Then we have the Gardasil, which covers up to 4 variants of the human papillomavirus, and then the Gardasil 9 that covers up to 9 variants. The good thing about this vaccine is that it has some cross protection, because the different types of the human papillomavirus are up to the high risk human papillomavirus are up to 30. There are so many of them, but we just have vaccines that are targeted at some of them, but they're able to have some cross protection. So even if you use the bivalent, that's the Cervarix, it can still confer protection on the other ones also.
Okay.
Yes. So it's giving, when it started, it's giving us 3 doses depending on which of the vaccines that is being used. Usually at the start of 0 months, 1 month, and then 6 months. For some is 0, the second month, and 6 months. So 3 doses are usually required to be administered to the children. As we said, the target is children or girls or children 9 to 14 years.
9 to 14.
Yes. And then there's what we call the catch-up population between 15 to 26 years. They too will benefit from the vaccine if given. But studies have shown that when the vaccine is used in children between 9 and 14 years, which is assumed to be before onset of sexual activity, the protection is almost 100%. It's 70% actually. But studies have shown that children that had this vaccine at that early age, 20 years later, in a very recent study done in Scotland, none of them came down with cervical cancer. Yes, and then those that had it between 15 and 22 years, the risk of developing cervical cancer in them was really reduced as compared to women that didn't even have the vaccination at all. So the good news is that studies are beginning to show again that even a single dose can confer that protection for a girl that's had this vaccine administered to her even at between 9 and 14 years. And the good news, as we said, is coming to Nigeria. It's already here. Yes. The government launched it in 16 states last year, and it was interesting to hear that the uptake was good in some of the states, as high as over 90% in some states. Some states had low coverage, about 36%, but I think it's something good. And it's coming to Plateau. It's in the pre-implementation phase.
Nice.
And they are hoping to launch it by May this year. So this is a call to everybody: get your daughters vaccinated. Once it's here, it's free. It's going to be available in all the primary healthcare centers, the government hospitals, so they can get it, even though it's just a single dose, but it's very effective.
Very effective.
Yes.
So from these studies that they've done, or they've carried out 20 years of having used the vaccine in Scotland and in some other places, so the people die, the people become infertile, the people, I don't know, all the rumors that have been going around about this vaccine.
You know, it's common whenever a vaccine is coming out. We know in the past, when we're giving immunization for tuberculosis, polio, a lot of rumors have been coming up. But I want to say from the researches that have been done, it's very important that the public know that the HPV vaccine is actually very safe as well as effective. And we talk about side effects earlier on. From the studies and people's experience, the side effects are usually minimal. Most of the things that people complain about is usually pain at the site of the injection, which doesn't
happens
last.
for most injections.
Yes, for much injections. So that, and then sometimes people may have fever, some form of dizziness, but this resolve almost immediately within 24 hours. So extreme side effects are really rare, have not been documented. So please, we should know that this is safe. Is a vaccine that we should encourage to come to stay. Just like we are able to eradicate polio, the vaccine is aimed at eventually we'll be able to eliminate. It's elimination that WHO is now even targeting, so that it will be less than 4 per 100,000 incidents, annually.
Great. So viewers, I hope we're hearing, we've listened, we've heard that the vaccine is safe and effective. So our phone lines are open. You can see our number on the screen. You can call in to make your comments or to ask questions even as the conversation is going on. Now, back to you again. Now, we want to look at the screening. How do, okay, you said every woman over 21 should get, okay. So how often do we come for the screening? And when people come for screening, what should they expect? What happens?
Okay, thank you. So the commonest screening, because there are other screening modalities, I need to mention that is the pap smear. That's what we have in most of our hospitals. The others are the HPV itself, the DNA testing, and then in the rural areas we are able to implement, since pap smear cannot be, we need an expertise to be able to read the results. We do this, what we call the visual inspection, that we do in primary health care centers. But pap smear is good. So for the pap smear, the screening should be started at the age of 21 years in all sexually active women. And then the screening between 20 to 29 years should be every 3 years. And for the age group 30 to 39, it should be every 3 years, but you can do it 5 years if you are able to do it with the HPV testing I mentioned earlier on. And all screening can be discontinued by the age 65 in a woman that has reached 65 years of age and her previous test result at least twice have shown that it's negative. She can actually discontinue. Or a woman, for some reason her womb has been removed, she can discontinue around that time, even though for some particular, depending on what they remove, if they left the cervix behind or not, then you may have to screen even if the cervix is not there. Then there are special group of women like those that have HIV test. It's very important that these women are screened more frequently. As I mentioned before, one of the risk factors is actually immunosuppression. So for those women, if you have HIV, you're supposed to screen every 6 months, at least for the first year of diagnosis. Then you do it yearly. So what to expect when you come for pap smear? It's actually a simple procedure. There may be some slight discomfort, but normally there's no discomfort. So you actually walk in to the health facility and say that you want to screen for cervical cancer. So site has been created, like in Jute, we have a cervical cancer screening site right in our gynecological clinic. So what you will need to expect, there are some instructions you will be given, but you just lie down, you insert a speculum just to be able to expose the mouth of the womb, that's the cervix. And then using a tiny brush or a tiny spatula, we actually just take the sample and then it's placed on the glass slide, and then it's removed and you are good to go. And your test will be out within 2 weeks.
Okay, so it's not a big deal. It's something that is easy to do. Okay, so what of women who have never been sexually active? They are more than 21, some are 30. Do they need to screen?
Well, the incidence of the disease in such women is very low, so usually screening in them is not really advised. It's mostly in sexually active women. And to add to what she said concerning the screening, those that have the screening results can have some abnormalities, and if even if it's not cancer, if such women were treated at any time during before the age of 65, they will continue screening 20 years after that, even if they go past the age 65. And the screening is done every 3 years. And again, the screening is only discontinued at 65 if the preceding 10 years are normal. So either you've had 2 years of HPV testing that are normal, or 3 consecutive pap smears that are normal. Yes, then the screening can be discontinued at 65 years.
Okay, what of women who are hearing about cervical cancer for the first time and they are more than 65? They are hearing about it for the first time. They said you should screen. What should they do? Should they screen, or they should say, oh, well, we're 65?
No, I think they should still screen. Yes, because so long as you've been sexually active, you've been exposed. And I think we need to be clear with the audience that anybody that is sexually active is at risk. There's an increased risk if you have multiple sexual partners. So even if you have just one partner, you're already exposed, because the virus is very ubiquitous, it's everywhere, the transmission is so easy to get. So that's why women must screen, even if they go past the age of 65 and they've never screened before.
Okay.
So they need to be screened.
Okay, so women, don't say, oh, you are more than 65, so you're not going to screen. Screening is for you. You should go ahead and screen. And just a quick one. When we say sexually active, it means you've had sexual intercourse before. It's not how, like one woman was asking me how active she was during the sex. No, is that you have had that you have had sexual intercourse at all puts you at risk of
infection with the HPV virus. And again, to add that it doesn't matter what your sexual orientation is. Sorry.
Okay.
So those that are homosexuals, lesbians are also at risk. So need to screen for the HPV virus.
Okay.
Yes,
Okay, now when we find out that you've screened or you've been diagnosed to have cervical cancer. Okay, let's start with the screening. If they find an abnormality, what happens?
Well, if they find an abnormality, depends on the kind of abnormality. We have low-grade abnormalities and high-grade abnormalities. There are some, again, and then it depends on the age of the woman. If it's in a younger woman, sometimes we just allow them, if it's a low-grade abnormality, they come back after 6 months, we check again, we screen, we repeat the pap smear, and sometimes the natural history is that most women that have the low-grade abnormality, they are able to clear the infection. Okay. Many people acquire this HPV infection, but most people clear it. More than 80% of people are able to clear it within 2 years. It's only about 10% that go on to develop some abnormalities, and then a few out of those 10% develop the cancer. So if they have the low-grade abnormality, they're able to clear it after some time. Then if they have a high-grade abnormality, there's another test we do, we call it colposcopy, which goes to look at the cervix at a high magnification, to look at the vascular patterns, that's the way the blood vessels are arranged there, abnormalities there, and then a biopsy is taken.
What's a biopsy?
Just a small amount of tissue is taken, usually we have a biopsy forceps, we just take a little and send it for histology. So they look at the tissue.
Under the microscope? Yes,
under the microscope. So the pap smear actually looks at the cells, but that histology looks at the tissue. So to know what kind of abnormality is it, the abnormalities are graded into 3, called CIN1, 2, and 3. So CIN1 is able to most times regress up to 60%, and then CIN2, the rate of progression to cancer is much more than CIN1, sorry, and then CIN3, almost 60% progress to cervical cancer within a short period of time. The good thing is that these abnormalities can be treated, cured. sometimes during the colposcopy, we won't see and treat there. We take a large biopsy. We just excise that portion and
So
send
you
it.
remove. That's
Yes.
what exercise is.
Yes, we remove that part of the cervix.
That is
and
abnormal.
Yes, and then send it for the viewing under the microscope. And if it confirms what we have seen before, we continue the screening for 20 years after that, even if the woman goes beyond the age of 65.
Okay. What other treatments can they do during colposcopy?
Yeah, apart from cutting it
Cutting
off,
off.
we can burn the tissues there.
Okay.
The problem with that is that you don't have any residual tissue to take to the lab,
Okay.
to look at.
Okay, and then you can freeze too.
You can freeze. Yes, yes.
Okay. Now we've made diagnosis of cervical cancer. What should they expect? Maybe a ladder. What is awaiting them?
So if you have been diagnosed with cervical cancer, it will depend on the stage of the cancer. So if for women who are being able to dictate, cervical cancer is able to be detected early, that's the early stage disease, then the treatment they should expect is surgery. Yeah, so surgery is able to cure them, but if it's a bit advanced, there are different things we can do.
What kind of surgery would they expect?
Yes, so the surgery they should expect is what we call hysterectomy, the removal of the whole womb. Yes, total abdominal hysterectomy. So we remove the whole womb in addition to the cervix. So that treatment is usually given to women in which the cancer is confined. It has not spread yet. As we said, cancers, what they do is after they touch the organ, they invade the surrounding, and then they can spread fast. So for women that has gone, it has already spread, then you don't offer surgery as the only treatment. So for some women, it may have spread, but surgery is still possible. So you do that surgery, and then we send them for radiotherapy. And then in other cases, especially since radiotherapy is not readily available in our environment, we give them chemotherapy. So depending on the stage of the disease, there are different modalities of treatments, which include surgery, radiotherapy, and then chemotherapy. What our women should expect, as we said, cancer is not a death sentence. Being able to present early, and if you have it, being able to have that support system, going to the right hospital, it's a lot of things can be done, and you'll be able to live, at least the quality of life will be good. So those are the different things. For some women, we do palliative care, so we try to remove whatever, as people that come really late. Yes, we try to remove whatever form of discomfort as much as we can in terms of managing their pain. And then because of the complications of this cancer, the bleeding, people come anemic, that with low level of blood, we transfuse them. And lots of transfusion, a lot of things go into play in terms of cancer care. Yes.
So when we talk about radiotherapy, maybe Awazi, you break it down. What is radiotherapy? What is chemotherapy? So that they know what we're talking about.
Yes, so radiotherapy is using X-rays, radiation to burn the tissues, and cervical cancer is a highly sensitive tumor to radiotherapy. So at any stage of the disease, whether it's early stage or late stage, radiotherapy can be administered to these women, and for early disease we can even achieve cure. But it's a form of treatment that we can give to women in any stage of the disease, yes. While the chemotherapy involves the use of drugs, we call them cytotoxic agents. Different types of cytotoxic agents are available, but there are some that are specific for cancer of the cervix. I don't know if I should bore the audience with the names. Yes, so these drugs are given every 3 weeks for up to 6 times. And before the drugs are given, tests are done to check the blood level of the patient, to make sure that the blood level is not less than 30%. We also check what we call the white cells, like the soldiers of the body, check the liver of the patient, the kidney of the woman before these drugs are administered, because the drugs are very strong. They also have their side effects. So we want to be sure that the woman is able to tolerate the drugs before they are administered. cancer of the cervix is not very chemosensitive. That means it's not advised that you treat them only with drugs, with chemotherapy. They have to have chemotherapy either with surgery or this chemotherapy with radiotherapy, but not alone. The problem in our country is that we have very few radiotherapy centers. I think there are just about 6. And most times, we don't have the 6 functioning at the same time. Sometimes 2 or 3, and, we have so many patients. Then to travel to those centers is a problem. The cost of chemotherapy is over 600,000, almost 1,000,000, and you need several cycles. So that has become a very big challenge in our center. So most times, what we do when we see the women, we combine chemotherapy and surgery, try to debug the disease. Even if sometimes, if they come, as she said, some advanced stages, well, we don't try to do that, but we can give them drugs, shrink the tumor, and still go in and try to remove it. Yes, because that has been shown to improve the quality of lives of these patients. Remember, I told you that some of the symptoms are the bleeding and then the abnormal vaginal discharge. So once the tumor has been removed, the bleeding, the smell that comes from that discharge, is taken off, and they have a better quality of life. Yes.
Okay, so what we're saying here is women go for screening.
Yes.
When you have disease, go early and go to the right place.
Yes.
Well, practically running out of time. I don't know how 1 hour suddenly finished. So, Dr. Lada, what last words would you have for a woman with cervical cancer today?
I would like to tell the woman, as we said earlier on, cancer is not a death sentence. And the fact that you have cancer, you come down with cancer, doesn't mean that our Creator has actually abandoned you. He's not in charge. He's still in charge. He's still in charge. So I want to encourage every woman out there to be strong, to fight it. It's doable. And apart from the woman that has cervical cancer, I also want to speak to the family members, because the truth is that having cancer in a family, it cuts across the individual, the family members, the community, and even the government in a way in terms of cost. So we need to be there for each other. We need to support each other. Together we can. Together we can fight this. These are my words.
Awazi.
Prevention, prevention, prevention. Get your children to get the vaccines. It will soon be available. Even in our states here, it's already available in 16 states. Go and get screened, and screen regularly. Because cervical cancer is a preventable disease. Prevention is not just better, it is cheaper than cure. Thank you.
Prevention is not just better, it is cheaper than cure. And for all of us who are affiliated with governments, government officials, those in leadership, now it's time to take action. It's not just enough that we voted you into power, or we voted them into power if you are close to them. Get them to hear these things and see the role they can play in making cervical cancer care affordable, available, and as close as possible to the women, so that we can kick out this cervical cancer and bridge the gap so that our outcomes will be like that of developed countries. So viewers, you have heard from Dr. Sarah Alada, from Dr. Awazi Onoja on cervical cancer. Please spread the news. Spread the news. Let people hear the real issues on ground. Let's stop spreading false stories about cervical cancer. People survive cervical cancer. People can survive cervical cancer. And people can have cervical cancer prevented. So screen, present early, spread the true story, spread the news, tell people around. And for the men, please support our women. Make sure your wife, your sisters, your mother are all screening. If they don't screen, well, I won't tell you what to do, but maybe no money. So that they screen, but provide the resources for them to go screen, encourage them, support them, so that we can kick out this thing. Thank you so much for staying with us, for not touching that dial, and for being with us till the end of this program. We look forward to seeing you again, same time, same place next week. Thank you so much, our speakers. God bless you
For
big
having
time.
us.
And viewers, God bless you till we come your way again next time. Bye.